Good evening to all our participants, research persons and members. Today we are hosting the CME on role of ICER in effective decision making for healthcare priority settings, a method of cost effectiveness analysis. This is our second CME in the series of health economics and outsearch by IACFM. I am Dr. Riya Roy, Assistant Professor in Department of Community Medicine in Shatinikotar Medical College, West Bengal. With me organizing this event is Dr. Rubina Saha, who is Senior Resident at AIIMS Bibinagar in the Department of Community Medicine and Family Medicine. She is the Acting President and Vice President of IACFM. We are joined by two esteemed guest speakers today. I welcome you again, Dr. Amit Mehto. Next, I welcome Mr. RAFAEL Niño, who is a Master of Science in Pharmacology from the National University of Colombia. We hope to learn so much from you in this 1 hour, and our participants are also very keen about this topic, since it's a very sparsely covered subject during the specialization course of our post-graduation in community medicine or public health. So without further ado, I hand over the session to Dr. Amit. Please proceed.
But I will begin with an overview of HTA, the status of HTA in India, taking about 15 minutes approximately, and then hand it over to RAFAEL, where he will actually take you to what it actually is, how it functions, and so on. And then we will try to have some Q&As. Right. So what is HTA? I mean, it's a good fancy term, health technology assessment. I would like you to think of HTA as something a technique which helps us to evaluate which of the health technologies, and health technologies can include drugs, diagnostics, equipments, and any surgical procedures and so on. So any health technology which aims to improve or seeks to improve health is evaluated or assessed using HTA, and we can make a decision whether or not to include that in our health system, right? So the cost of healthcare across the world, including in India, is increasing, and there should be a way to rationalize or to make informed decisions on which health technology that the government is going to sponsor or support and fund, and which it wouldn't. Then coming on to the HTA India, the new framework, I invite you all to read for yourself, explore the website. It's very self-explanatory. But with this slide, I would give you a taster of what HTAIn is.
Little kinds of type of economic evaluation and the outcomes we need use to express the correct result of the correct risk. Okay. In the beginning, we have to talk. We have different types of economic evaluation because we could express in different ways the health gains and the health outcome gains. In the first part, we have three different kinds of economic evaluation. We have cost effectiveness, cost utility, and cost benefit. All of you one time have seen the general name of the economic evaluation is cost effectiveness. That's why we use cost effectiveness for everything. We have to start any one evaluation using a natural units or natural clinic units is the type of health effect that we assessed in the cost effectiveness. We use that kind of measure like a GR gain, like a blood pressure, like a hemoglobin in control of diabetes. All of the indicators of the prognostic of the pathology could be used to express the ICER. And then we will have aggregated cost difference divided in health outcomes difference.
Is there any evident difference in how the health technology assessment and the cost effectiveness is used in this health technology assessment right now in India and in Colombia? If you can give some insights.
To summarize, I would say that it's not a standard practice to use HTA for every new drug, for every new technology, etc., etc. But I would be very interested and curious to learn about how is it in Colombia, RAFAEL, and in the South American region, Latin American region in general.
Okay, in the general history, we have made HTI about 20 years ago. More officially, 10 years ago, with the creation with the agencies, with the HTI Agency of Colombia, is the leading group in the South America, with Argentina, Brazil, and Peru or Ecuador. They have also some agencies. We mainly we have a strong methodology researchers. We generate a lot of evidence and evaluation of evidence. But as you say, the second part of the HTA process is discussion, make appraisal about the result of the ICER, of the efficacy, of the security. We are working in make a better process of discussion and the appraisal to make a general recommendation, and the process is very particular or very private. You can find the discussion or the I don't say the published of the process. They are very close and very in private rooms, so the general public don't know the discussion and the recommendations. There are a lot of problems between the recommendation and the adaptations in different contexts. So we are working a lot in make a social discussion and make a social network of knowledge about appraisal and about the recommendation of different contexts, because we have a lot of problems as in India, I think, different situation, context, technologies, and opportunities to access to the health system. So the way the Colombian HTA thinking is improve the appraisal and the publishing of that process in that moment.
Like Dr. Ria has already said that we are already confused about what is cost benefit analysis, what is cost effective analysis. Many PGs during their PG courses, they are already confused by that. So nobody takes up the interest to go and do a daily and a quali. Like we have a lot of the burden of NCDs in India is like prevalent, like they like the diabetes and hypertension. So if we can do such kind of analysis, so it will be benefit not only for the I think for the policy making also, it will be very much helpful in the future. So I would like to thank Dr. Amit once again and Mr. Rahel once again, and for accepting our invitation. I hope in the future we will be conducting more sessions on health economics.
Okay, thank you, Dr. Rubina. I hope you can hear me all. Any more further questions, you can mail us to the email address that we have sent. And I hope you have enjoyed being this webinar with us, especially Mr. Rafael, who is first time here. And I hope we can going to collaborate with you in the future. I thank all the participants for coming. Any questions, any queries, you can send us, and we will send the certificates very soon, within a week, to all of you. So thank you, and with your permission, we are closing the session.